March. Instead of Village Week, we're having a full Village Month. And I feel like this is one of the best ways that we can kick off an opportunity to connect with one another, to build community, to really dive deep into what our capacity building opportunities are, by first being joined by the amazing Dr. Areola from the Department of Health. And so many of you who've been following along on our journey know that the origin story for the village occurred within Mayor Cooper's administration. However, the actual sort of source and distribution, for those who are familiar with how council dollars flow, has been through the health department. And so over the last couple of years, we have been navigating our relationship not only with larger systems as we think about funding allocation that comes from city council, but then at the department level, where there are issues that specifically intersect with the priorities for the village. How do we build deeper relationships, and not just from an operational perspective or administrative perspective? We need the money. We need to make sure that we meet all of our requirements. We make sure that we have deliverables that are sound and that sort of fit within a larger picture. But ultimately, how do we tighten that web of understanding? How do we build the bridge between community? And we say this big like systems partners, but on a local level, that looks like we have a health department that provides support not only for individuals in our community, but also through the lens of many of the nonprofits that are in the village. Last year, I had a chance to sit as a part of the budget committee's subcommittee to focus on nonprofits specifically. And so that was an opportunity to say, how can the village sit at the intersection of where systems and dollars and local departments see and understand their theory of change as it relates to important community issues, and where on that continuum do our nonprofit leaders have agency, have opportunities, and also can amplify their work. And so there's been a number of unfoldings in our community here recently. Admittedly, many of you reached out following the official announcement of the Community Safety Task Force. And that facilitated the need for some clarity, some honest conversations. And one of the places that I'm so pleased, Dr. Ariola, that you've been in relationship with me and willing to have conversations and hear and understand the work of the village. And we both decided, let's have the conversation, right? The conversation that we're able to have over lunch or in your office or at CFMT or over Zoom. How do we take that public? How do we make what is maybe implicit, and not because we're trying to play a game of keep away, but because folks have just not been involved in the process? How do we make those understandings more explicit? And so we've agreed to sort of pilot this table talk time. Our team has just been calling it Ask Dr. Ariola, and an opportunity for us to be in conversation with one another. And so thank you for joining us here today, and for greeting the folks on our village call.
Thank you, Erica, and good morning, everyone. Thank you so much for having me. So very recently, I just finished my first year here. Amazing how time flies. But I connected with you even before I started. And look, public health is so broad, but at the heart of it, though, is engaging the community that we serve. There's a reason why it's called public health. So what I really want us to do is to emphasize the public in public health. So I've got things that I think are very important to health, and none is bigger than building a healthy, trusting relationship with the community. One of the things that I like to say is, I haven't seen a single not-for-profit organization that's now born out of the recognition of a gap or need in the community. So the entities that know the community, the entities that understand the norms and values of the community, you cannot do public health without building strong relationships. And that doesn't mean that we're going to agree all the time. That doesn't mean that we're not going to see differences in opinions. Actually, I think those are necessary ingredients for growth. So thank you. And when I got here, one of the issues which I think you alluded to was the little pot of money. Even getting the pot of money to the community from the health department was a challenge. But within the first few months that I was here, I literally met with every single entity, including you and several others perhaps on the call. And we looked at the challenges, but the goal was always to get to the end point of making sure the resources go to the community, which was the intended. That was the we didn't want to be the obstacles. I don't want to do public health strictly from lens public health. That's not going to work. I wanted to do public health in the community, and that's where entities the village, members of the village come into. Now we're talking about community safety. Yeah. But that is true for every other thing. It's true as we're trying to combat the increasing trend in tuberculosis. That's true for combating the spread of HIV or other STIs. Look, I give the example all the time during COVID. You know, the fact that we did not have a strong enough relationship with the community, especially the Black and brown community, really came back to haunt us. So, because then we had these vaccines and we're giving out the vaccines, and people are hesitant to take the vaccines. And sometimes there are entities that are offering people money to take the vaccines, and the community is like, there's got to be something in it for you, because prior to this you weren't talking to me. Now you're offering me money. So very important to build those relationships for community safety, important to build it for infectious illnesses, important to build it for emerging issues that come, important to build resilience, and that resilience in the community that allows community to withstand things that come is built on what the village represents, built on making the community stronger. It's built on addressing physical challenges. It's built on addressing behavioral and mental health challenges, built on addressing social challenges, built on addressing emotional challenges. So as I've said to you several times, and to all that are here, I look forward to working with all of you. It's a very important part of what I do.
You mentioned so many things and on me, you know, that I want to go. I want to tap dance on so many of those nerves. But I want to start in a place that is really important for the village. We want to know a little bit about you. There, folks know I allude to that, you know, the iceberg, and the reality is that we carry that 90% below the water. And so, yes, we had a conversation even before I think you were hired. I actually sat in on your interview at one point. There was lots of not only buzz but excitement, and then also the shared sense of accountability. One of the things I was impressed with during your interview process was, one, you recalling the historical realities that sort of informs not only who you are but then how communities move. And so sometimes I'm going to name one of the tensions for me is that, and you mentioned COVID, that we want to treat what's happening right in front of us. Black and brown folks are not getting vaccinated, and so let's throw some money at it. Let's figure out how we can get ambassadors, et cetera. But you named something that was so true, which is there's decades of mistrust. There was decades of exploitation. There were decades of, I mean, let's be honest, some real oppressive and unethical behavior, right? And we remember that in our DNA. We remember that even more so than the individual entity. And so it all sort of gets plastered together. And so for the work of the village to be meaningful, to productively move through moments of harm and trauma in a way that makes us better, not just resilient, but makes our ecosystem better. At the heart of that is knowing who we are in relationship with. And so I would love to know a little bit, for you to share a little bit about yourself, Dr. Areola. What are you bringing to this role that feels important for the village to know about you?
Thank you. Excellent question. So I attended the real TSU.
Oh, that's how you're doing this. You're in the wrong place.
No, I'm kidding. So I attended Texas Southern University.
Show them. Are they some tigers too? Something.
Several years ago, and then and I worked on lead, impact of lead on learning and memory deficits, and then did my postdoctoral training at Baylor College of Medicine, also in Houston, working on drugs of addiction, how they impact the brain and the behavioral models of addiction and the scientific premises for addiction. In 2002, though, I came down to Nashville really for the lifelong interest of doing community level work rather than scientific work. And so my two children grew up here in Nashville. I lived here for almost 18 years. Worked at the health department in multiple roles. Got to know the community, some of the community-led initiatives of addressing pollution around Edge Hill community. I led that when I first got here. When we had the flood of 2010, I led the 35, 40 employees that was all over the county, just talking to people and helping people figure out how to recover quickly from those. Really, I've been part of everything I've taught at Meharry, Tennessee State University for so many years. And so my approach to public health has always been grounded in understanding the community. So in public health, we have several of us who are scientists. We sit down and do what we call risk assessment, looking at the factors that contribute to the making people more susceptible. Well, for years we do that by reading books and reading journals and sitting in our offices. And then we take these things to the community and they're looking at us like, what's wrong with you? This is theoretical. So you can't do those things if the assumptions that underlie those things do not represent the community.
Yeah.
So that's that. If you really listen to my writings and public comments for the past 20 years, that's been very, very consistent. You got to build relationship with the community. You got to involve the community that's impacted, both in defining the problem, but even more importantly, in defining the solution. And so that it doesn't matter what we apply that to, whether it's community violence, whether it's tuberculosis, whether it's whatever that impacts us, just the involvement of the community is very, very important. So I've got during my interview here and really throughout my career, when I left in 2020 and I went to Johnson County, Kansas, and from Johnson County, Kansas to Prince George's County, Maryland, where I worked for the third Black woman ever
That is
elected
not
to the Senate, Angela
for
Ossobuc. It was the same construct of getting the community involved. So you will see me in the community, like I just don't talk the talk. If you invite me to any of your programs, I will be there, depending on my schedule. So I like to work the community. I like to attend events. So to have conversations with the community, so you understand the community, and I think that's as important as keeping up with current literature, so you understand what's going on. Because the communities are changing. Nashville is changing. At one time, we had over 200 people moving into Nashville daily. So North Nashville is different from North Nashville when I got here in 2002. So those changes, obviously, Antioch is very, very different. So those changes, we have to track those changes and make sure that we note and incorporate those changes into analyzing the risk, but also into defining what are feasible options. So to your question, the if somebody asks me what to do you what do I want people to know about me, is that I will emphasize the public in public health. I want to build relationships with you. We don't always have to agree, and I'm pretty comfortable with you calling me out. But I want you to know that you are important to what I'm trying to do. In fact, it is impossible for me to do my job if I don't have extensive program that engages the community.
Yeah.
That's all.
Yeah. Brother Caldwell, if you're on the call, you sent in a very specific question asking if our public health officials would be willing to come and spend time with our programs. And I think we just heard Dr. Areola say he would absolutely enjoy being invited to some of the community events. And we'll come back to that question specifically as it relates to deeply understanding where those intervention and prevention services are anchored in our community. I want to jump in. We're about 20 minutes in. We got about 20, 25 minutes to go. And so I want to make sure that we are answering some of the topics for today. And so I thought out the gate, let's talk about this community safety task force. And so my first question is to tell us what is the task force and a little bit of the origin narrative from your vantage point.
Right. So thank you. First of all, to Brother Caldwell, if you invite me, I will come. So today I'm actually visiting one of your members and talking with some of the kids in the programs, and I've already met with quite a few people
Wonderful.
in the village. So just bear with me. And if you have programs, we have a team of employees that are out in the community doing outreach and community events. So you can go to our website if you are having something and you want health department to be there. We have you can know how to request for those. Happy to share those with you.
Yes,
So you can share with the team. So community safety is something that I have worked on for so many years, conceptualizing how to, we've talked over the years how violence is a public health problem. And there's been quite a few things out there from CDC to other organizations that are putting out information there. But I wanted to get it into a way that is practical for communities. It is one of the key reasons why I went to Prince George's County, Maryland. So over the years, I have done a lot of research. I was here also when one of the coaches, London Matthew, and I believe that was either Calvin or Megan Barrett. We've had so many efforts in the community, but there's not a follow through.
Yeah.
So I took all of those into consideration and developed a framework as a starting point of what it means to address that from a public health perspective. So first of all, what we are doing does not involve what is it called now, holding people accountable.
Okay.
So what we are doing is based on the assumption in public health that if kids are products of the environment that they grow up in. So if we build an environment that allows kids to prosper, if we build an environment that builds positive childhood experiences, if we give kids the opportunity to have places to play, if kids have access to parks, if kids have access to after school activities, if kids have access to 3 square meals and they're not hungry, if kids have access to healthful housing, the products that we're going to get is going to be different. And so that's really the point here is to build those positive experiences, things that reduce the traumas that kids are exposed to, and make it, after all, in public health, that's how we define public health. We define public health as what we do collectively as a community to ensure conditions where everyone can be healthy. So you can't tell me to be physically active if I don't have sidewalks or if I step out of my house. I'm afraid of gunshots, or I'm afraid of how I will be policed, or afraid of dogs running our lives. That's going to stop me from being free to play around. If you want me to eat healthy, make sure that I have access to food that's helpful and that I can afford. So that is the construct. It doesn't remove the needs for other parts, doesn't remove the needs for the courts or law enforcement. It's just saying public health, our job is to build environments that give kids and everyone the opportunity to be as healthy as they possibly can.
Okay.
So using that construct, you will see the outline that we have developed, but also consistently understanding the community is going to have to shape that to fit where they are. So when I started that in Maryland, it was more about youth violence. So we shaped that based on that situation. And Nashville is shaping that in different ways. But we've got 12 sessions that includes just, coming up with a task force, making sure that we are understanding the strengths of the community, the resources that are available, and there's no bigger resource than this group, community organizations that are there doing the work. And then, but also looking at, so tapping those resources, but also looking at gaps. And then working with policy makers and decision makers to be sure that we are intentionally filling those gaps and bridging those gaps. And so with very, very specific recommendations on how to do that. And we don't want perfect to be the enemy of progress. So this is not going to be perfect. And it's a living document. And as things progress, the community should be receptive to adjusting the plan as they go. So that's what the public health approach is. It's not one or two people sitting down in an office writing that I could do that. It is letting the community define what that is, define the resources they have, define the gaps, define how they want to bridge the gaps. So they have ownership of the process. That's what we're trying to do. Also important to keep policymakers, elected officials. That's why really kindly very appreciative that the mayor took on this initiative. Doesn't matter what I do. I don't dictate where money goes. I don't have that prerogative. So it's important to work with elected officials so that when they have the buy-in and they see, they don't have to agree with everything, but they can ensure that resources go into building this resilience, these things, these conditions, this environment in the county that allows our kids to grow rather than to be brought down by troubles.
So I want to go back to she needs to adjust.
I need him to move closer.
Yeah. Yes.
I'm going to go back to my iceberg visual. If we are looking at the Community Safety Task Force in this snapshot, talk to us about what's above the waterline. What are those tangible outcomes? What are the things we're hoping to produce? What is the final product? Maybe even a little bit about the process for folks. And then I would love for you to talk about how you see this process as really coloring the water around public safety, around communities' involvement and engagement. And to your point, you started from a place of you can't necessarily hold people accountable. But if there is a collective plan that's been curated, the strategist in me understands that there are possibilities to create the right web so that the resources rise where they need to rise. Can you make a little bit more explicit some of the ways in which you're hoping this process will shift or color that water? And I'm going to say a little bit sort of juxtaposed to the limited actual outcomes that will be produced from this task force.
Right. So to thank you. Excellent question. First of all, to be clear, myself and my team, we stayed away from influencing or coming up with recommendations for the same reason that you finished with. The community has to have ownership of the process, ownership of the recommendations. And that to me is so important because if it is seen as something that's off the shelf or something that I put together, the buying is going to be, it's already difficult to get buying. So that, but in every community, including ours, there are, political considerations, there are historical issues, there are personality differences, philosophical differences, but that is the reality of every community. And so we've got to take that into consideration. For me, as a public health person, it's important, and I've been very intentional over the years to really look at things only from the perspective of is it good for health or not. So I have stayed largely out of philosophical or political affiliations. The only philosophical affiliation that I have is to health, because my goal is to make everyone in Nashville, to give everyone in Nashville the opportunity to be as healthy as they possibly can, no matter what their political affiliation is, no matter what their race or demographic or social or sexual orientation is to create environment in every part of the county for everyone to have the opportunity to be as healthy as they can. But I am not unmindful of the politics of this, which is why it's important for the number one citizen of the county to really buy into this. And I've spoken to him several times, and I'm not getting into politics, but the mayor O'Connell, has he bought into this? Absolutely. And I think you guys are going to see that. I know they have to make decisions on conflicting or different priorities, but you saw him at the first meeting in terms of the overall construct. And his very first comment when he opened this up was, we don't want this to sit on the shelf.
Yeah.
Lorna Matthews has been working on this for years. Actually, is one of my inspirations. I really went back into some of the original efforts that led to my brother's keepers and those things. And I've used those things over the years to kind of develop what I put in place. So, but one of the things that I learned early in my career in public health is you can have the best thing put together, you can have the best science, you have to navigate the political structure.
Yeah.
You have to navigate that, you have to carry people along. And so I mean, I have met with so many people about this. Even before the mayor announced the task force, I've met with so many people, elected officials. Also, it's important for the people to understand what we're trying to do. This doesn't work if there's no resources put behind it. This doesn't work if we don't stick with it. This is not a sprint, it's a marathon. We have to keep building on the things that we are already doing and expanding them. We've got things that are ongoing. We've got entities like Urban League that are training people, not just to get any type of job, but high paying job that can sustain them. Those are the things we have. Those are positive things that we have to continue to do. We've got conversations with parks. We have conversations with entities that are looking for to build parks and sports activity for kids to do. That's where we want to steer our kids, and that's the overall construct of building conditions and environment that allow. But politics is a big part of it, and we've got to keep our elected officials.
So I'm gonna do a little translating from some of what I hear, and you can tell me if I'm incorrect. Now we're having a real conversation.
Yeah.
If we co-create something, a plan,
Yes.
is that part of this task force? There will be a plan or a list of recommendations.
Both plan
Okay.
recommendations. Yes.
Okay. And I want to be very clear. There is not committed funding at this time
No.
to executing in any of it. There is sort of trust that as this process unfolds, the conversations that you're having with folks, the work of the village, the work of the other community bodies that will be brought into this outside of the task force, because there is a concerted effort, and Kia Jarman is leading that effort to make sure that there are community voices that are able to not just speak into a plan, but also react and respond to what's happening in real time at the task force. That was something that we were adamant about as part of this process. And ultimately, we want to create the right conditions for folks to resource against these plans, right? We want to create the right buy-in and ownership of the process, that even I'm thinking from a philanthropic lens, that there may be local foundations that say, if there's a community lead, we know this is part of a comprehensive plan, we would be willing to put dollars behind it.
Yeah. So let me just kind of character that based on the last thing you said. I was approached last week by one such foundation who is already talking about how they can push resources into the communities to support this. And so you're going to see a lot of that once the plan is very specific about what we need to do, and maybe have some short-term goals. What we do the first 1 year, first 5 years, first 10 years. You're going to see elected officials be more willing to fund specific things, and you're going to see foundations. So that's not something that's absolute, but foundations are already thinking about how they can get involved in this. So I just wanted to make sure that
and because we agreed to have this conversation in the most, I think, honest and authentic way possible, I will name for the village and for us in this room that the reason I agreed to be a part of this process was, it almost feels counterintuitive, but it's knowing that there is not a gatekeeper for the resources that will then either flow because of this plan or sort of through the plan, because I have seen what that looks like in community. We have seen when those resources are bottlenecked or even maybe fire hose from one specific location, how that pushes folks to the outside, how that creates more silos than what's necessary. And the politics that you name, both big P and little p, seem to be amplified when there is a single source or a single goal. And as we're talking about the long game, because we are actively reconditioning ourselves to understand impact, we are actively reconditioning ourselves to understand, even, reimagine what this historically charity model has looked like. How does resourcing internally to ourselves still hold people to the fire? Reparations are still where we need them checks, and making sure that we are able to get what we need to get taken care of internally. For me, part of the draw through the surveillance drama, through the let's be honest about who's not at this table, who was not invited to participate. Part of the draw is if the village is there, if Black Mental Health Village is there, if Past the Beauty is there, if the contributors there, there are folks who I know have some of our most vulnerable and marginalized members of our community at heart. Then there is a way for us to find, and I'm going to quote Dr. Hildreth there, small field goals around and win the Super Bowl, right? There are ways to win this by finding those small field goals. And it may not be everybody's field goal, but within those smaller groups of folks who are committed to tightening that web, I do believe that there are pockets of donors. I believe there are pockets of elected officials. I believe there are pockets of department leads who are willing to stand with us, even if we don't see the big win. And some of this chipping away, some of this let's have this conversation, it is to flex the muscle of that long term. And it is hard, especially when you've been exploited, especially when you've been ignored, especially when we've been overpromised and underdelivered time and time and time again. And there's some real skepticism. We have a couple questions coming up where folks have, real concerns. But my why is understanding that we have to be engaged for the long game. And if our voice is not at the table, then we lost before we even had a chance to get on the field.
And I can understand that. The other reality here is the task force is you know 29%. That's already pretty low.
That's hard.
Everybody cannot be on the task force. So I think the thing for me is from the first two meetings, just the energy and the enthusiasm from folks and what we are seeing from the village is to me our positives. And even when we have issues to iron out, I think that's good. I will say this. I will say this, and I've said that again. We talk about so many people, philanthropists and foundations. Again, I know what my conversation has been with the mayor, and I know that something really good will come out of it. I can't speak for him. He's gonna have to do that when the time's right. But also even at the first meeting, and when he is committed to this, and to be clear for me, you mentioned that, so as the director of the health department. I all I want is for the community to have this resource. I don't need this housed in the health department. I don't need to hold on to any part of the money. I just need to know that this is happening in the community. And so my goal is to push the resources to the community and to support the community however we can. And so I did mention I've met with several people on your team. I did meet with Gideon's Army, and I'm going to their facility later today.
Good.
And so again, my goal is to support you in the good things that you do.
Community is messy.
Yeah.
Right? Like we are complicated, we are dynamic. Rashida calls me before and after just about every community task force meeting. We have a little bit of back and forth, and so that is another part I think of holding each other accountable, but then also carrying each other with us.
Yeah.
It is no surprise to the folks in the village. We know that Gideon's Army has been blackballed in a very specific way politically. You don't have to respond. That Gideon's Army has been blackballed in a very specific way politically. We also know as a village that there is great work that is happening. And so part of our responsibility at the table is to make sure that those organizations who, for various reasons, right, some that are from an administrative perspective, some are personalities, et cetera, and history, that the work is not being ignored, and that we are able to amplify what's happening. I want to ask a quick question before we go to some of our village members. And that was a great segue. You saying like this is not it's not my plan. I want the plan to happen. It doesn't have to live the execution of it. What do you hope will be different? And this is someone who graduated from Tennessee State, went down the street at Vanderbilt to study community, cycled through grant after grant after grant of community participatory this and this and this. And I can't really tell you, one of my partners in crime is notorious for saying, so what's this going to be next? Right? Knowing that there's going to be this sort of rolling stone of community development. Give us some tangibles. What do you hope to be and see different? And maybe let's do like 1 year, and then maybe let's do 3 years, and then maybe let's do like 10.
Yes. So the conceptually for me, note that I am not on the task force intentionally. Myself and my team and the mayor's office, were supporting the task force behind the scene. But if we do this the right way, we have plans for what we're going to do in the first 1 to 5 years, and then 5 to 10, however it comes up. So you ask me, what will be different? I think the first thing is keep it simple. That's the first thing. Nothing. I mean, I've been part of so many community-based participatory research. At one time before I left in 2020, I remember being in a meeting. I'm just like, when are we going to stop studying North Nashville and actually put resources and do something?
Yes,
We do all of these studies and then you come back and go, oh, it's another study. So I've done enough of that in my career. Currently, I've done enough of low-hanging fruits. I want to do things that are impactful. You will see that in my very first few months, virtually everyone that was supposed to receive funds from the community safety funds there. I met with everyone and I got everything over the finish line. Because to make an impact, our job is not to hold on to the resources to try to do everything ourselves. No matter how much I think I know Nashville or how much I know public health, I am not in the community like your groups are. So my job is not to try to do it myself, it's to push resources. So we are working under the assumption that we have the right organizations. And if we don't, others will fill the gaps. And so the second part of that is now to know what these entities are doing, what they bring to the table. And the third part is to make sure that they have the resources to do their jobs. I am not under the illusion that Metro alone can fund all of this. But if we do our job right, we get foundation where we'll be able to apply for grants. If we need to support entities to write grants, to let out support, we'll do that. But just to pull in resources from, it's easier to pull resources when your path is clear, when what you're trying to do is clear. That's the clarity that I think should come out of the task force. And then we need to give it time to work, to stay with it consistently, to commit resources to it consistently. The assumption that if we do it long enough, we change the environment, and by changing the environment, we change the outcome. That's what I hope. So.
Thank you for that. I think that's a great segue. We had a question that one of our village members sent in specifically around legacy. And I think I'm looking at my team. The question was something to the effect of, what are you hoping your legacy will be here in the city?
So I've done public health now for almost 30 years. And no matter how I look at it, I think I am close. I'm in the last quarter of my career, at least as a public servant. And I said that earlier that, I've done a lot of impactful works. I've led Johnson County, which is the largest county in Kansas during COVID, but nothing is bigger than what we're currently doing. And I came down to Nashville intentionally for this. It's to number one, demonstrate to the public health community that there are plans that are out there. The approach though is a little bit different than what we're doing. The biggest part of this plan is community engagement, community involvement, and community ownership. So, and this is actually, if we do it right, it's bigger than community safety. Like I said, it impacts everything else that we do. If you change, so if you move upstream, we talk about this social, political, economic determinants of health. If you're poor, your health is poor. If we do the things that we're supposed to do, we change the trajectory of those social, economic, and political determinants. We change the context in which people live, work, play, and there's so many outcomes that are impacted positively. So if I am part of this effort to design a plan for Nashville and mobilize the community and elected officials for us to start implementing that, we're not going to see a lot of changes in 1 to 2 years, but you start seeing changes 5, 10 years. I think all of us, you and I, everybody listening, we will have done our part to impact the current youth, but also create better opportunities for those that are coming in the future.
What are that's amazing. I would love to see a Nashville actualized where that is at the core, that is resourced, that you feel the difference. I think I shared with you over lunch that the learner in me enjoys being in spaces with public health officials who get it and who have intentionally worked with community. Those are my favorite panels to attend. Those are my favorite workshops to go to because you see the science and you also see this larger systems approach, but that understands that the only input and output has to be filtered through community. 100%, and that excites me as a possibility. I'm gonna drill down and ask a question that was brought up in our chat. What are some of the strategies for addressing how our systems partners, and we'll use the health department in this instance, can be in better community with the folks that they are supporting, and specifically by way of these organizations? And so you've named, you got it over the finish line, and that has been a language you've been using. Is this contract over the finish line? Are we making sure that we're starting the process of payment, et cetera? What should we expect to be different in the way we are able to interact with departments like the health department?
Excellent question. So the health department really does have very extensive engagement with the community. We've got the Nashville Health and Wellness Leadership Council. We do the chief, the chair. We have a long history of engaging the community. What I have found, though, in my years of experience, not just here, but in Kansas and Maryland, is that even when got back to Nashville, I'm still seeing the same people at the table. Yeah. And so, if I do community engagement, the way that I envision that. And we're working on this is part of it. It's going to be so extensive, it will be obvious to everybody. And we are working on that to make it be very intentional about emphasizing the public in public health. I cannot overemphasize that. That's very important. Now, to even so, metro processes, government, we call it things move at the speed of government. So that's a reality. And so we are working within the health department on optimizing our processes.
Yeah.
But there are also some things that are outside the control of the health department that are more metro specific things. Some are state specific things, some are federal specific things. But we're working through that. To again within the government restrictions to see the best that we can do. I think part of what we need to do also, Erica, is to educate the community about what the processes are better. Because once people understand that, their expectations are tailored more towards that. But when I got here, my goal with everyone I've met with, I'm not here to say yes or no, or try to gatekeep. I am trying to get us to the finish line to make sure that we get to where we need to be. And that's the approach and I think just building the relationship and having trust, I think that's been very, very helpful. But the process is we're working to optimize that within reason, but it's still a government process, and that's going to be slower. So, but part of our job, though, is to educate people and let people understand. For example, when even after we have all the documentation, one of the things we can do is let people know the documentations that are needed. Even after we get the documentations, it has to go to the board of health for approval. It has to go to Metro Council. That by itself could be a 3-month process. Yeah. So if people understand that, then they can plan accordingly. But part of that also is to know the documents that are needed, and to be as candid as I can be. Also working to see if there's a way to streamline those documents. Some we have no control over. It's by law, about identities. And so here's the other piece. There are a lot of not-for-profit organizations and small operations. And so I continue to, there's a model somewhere where, depending on the amount, a small not-for-profit organization may not have the resources that a larger entity will have. And so how do we support them?
Yeah.
And I love the idea that you have with the village. Are there, like umbrella organizations that we can pair entities with that gets the funds and make it easier for them to get so they're not looking for 3 years of audit? Those are things that we have to look into as a.
So one of I said in a couple of weeks ago that I think some of the shift that I'm experiencing is from the end of the spectrum of around compliance to true collaboration, and we definitely are not on the collaboration end from a systems perspective, but I think from a programmatic and understanding, yes, the educate piece around compliance is 100% important. We have to understand how systems work so that we can manage our own expectations. And this is what I will say that you cannot is that, and then also we can advocate for things to change.
Yeah.
We have to understand how systems work in order to be able to pinpoint what doesn't work and be able to identify why it doesn't work. That's the long game, right? Like it's I can be upset that I didn't get the check, and that's real. We have to lay people off. We have to stop programming. We need to be able to mitigate around like a real loss. There's a difference between saying, here's the list of what's necessary from paperwork versus where I've seen your department involved too, which is now we're actually having full conversations about the list. We are walking you through where to find this list. We are putting it in a place where hopefully you can access this and also give you everything in writing. And so the education, and I didn't hear it this way, but I want to make it explicit for us that sometimes we say we need to educate folks as if that is going to satisfy an appetite or right something. In this instance, that education is a piece of a larger strategy that then also hold people accountable, right? If we get to the end of the day, and I had council members sit in that budget subcommittee with me, and Jeff Gregg leaned over and said, Erica, this is not going to change tomorrow. It's not. Like there's too many laws, there's too much red tape. And so at least for the next year, right, this will be the reality. But let me tell you what this committee heard. Let me tell you where we're going to dig deep. Let me tell you where we're going to get curious about innovative ways, even thinking about it's not just a community foundation that can serve as a fiscal sponsor, but there is a village. There are multiple organizations that have the capacity that have maybe not been at the table historically. That these type of relationships allow you and your team to see possibility so that we move further on that spectrum away from just pure compliance.
Yeah.
And then we're working in community. We have 5 minutes. Yeah. I have one question that I think we did not get to that was sent in ahead of time. You alluded to this, but we would love if you could get really clear and talk to us specifically about violence as a public health issue or crisis. Make that correlation for us.
Right. So actually, if I during my interview, I actually put a two, maybe three pages together. One was on violence, the other was on opioids. So when I talk about something being a public health issue or the approach in public health, it really means it's community led. It's huge in community input. It's driven by data. And at the top of that, when you sit in, you see all of these crime statistics, crime numbers over the years. Those are fine, those are good. But the biggest thing that I don't always see in those data are data that informs us about the community that is impacted, about the community that we're serving. That's what I call the norms and values of of the community.
Okay.
Which is why you bring in community people to be part of that. So, good example. So, when we are doing analysis of the risk, which is again what we base our interventions on, the only way that your analysis of the risk is accurate is if the assumptions are accurate. And the assumptions cannot be accurate if they don't reflect the norms and values of the society. So again, the norms and values, demographics are different between North Nashville and St. Bellevue or Belmont. So the factors that are going and the socioeconomic status is different, environment is different, demographics is different. So you cannot just have take something off the shelf that works in Westmead and think it's going to work in North Nashville. It might, but it will not. Your best option is to make sure that the assumptions reflect the community that you're trying to serve. So that's the public health approach. You can't understand. That's why people that are not typically at the table have to be at the table. Yeah. Because when you think something is gonna, I'm not going to mention detail. There's something that I was doing recently, and somebody uh, uh, just said, "Well, you can't do that because this is what is going to project to the community," and that's somebody from that community. Mm. If that person wasn't at the table, I will run with that, and then I'll get to the comment, and they'll look at me like, "What are you doing?" Mm-hmm. So that's public health approach. It's using data, including data that ensures that the closer that the assumptions we make are to the truth, the better our results are, and the better the interventions that we choose will be. So that's public health. The other part of public health approach then is we're very specific about what we're trying to do, mm-hmm. and we track the things that we're doing, and we track the impacts of the things that we're doing. But we also know that nothing is etched in stones. We're also researching and adapting as new information comes along. So all of these things that really is what public health approach is. It's more specific rather than just sometimes that's what we do. We just doing trial and error. We get this new school, let's do it. There's not a concerted effort. Mm. So this will give us a concerted effort and multiple programs that are driven through this effort that we can track how well they are impacting and what we're trying to do.
And so I want to make it plain for me, yeah. Understanding that those assumptions have to be as close to reality, the context have to be as close to reality, then gives us a direct sort of feeder pipeline to understanding violence, their impacts, its implications. And we don't have time to talk about it today, but then I would love to maybe on our next talk explore what I'm seeing as the other side of that, it's around safety, right? And so how when we are informing a space by violence data, to your point, like what's the opportunity to see and understand from a perspective if we're using safety and sort of what are those measures. But the connection between violence and public health is really, it gets at those the assumptions, the conditions that are most true within a community and how those essentially overall impact folks' ability to live and be healthy.
Yes, couldn't be more well put. So the other way to look at that is this. So a lot of time what we do is we treat symptoms. Mm-hmm. And so if I have a water leak and I've got a bunch of towels and I'm just mopping the water, mm-hmm. that's fine for a while. But I got to go upstream to fix the leak. That's the more impactful thing. And that's what public health does. Let's figure out those factors that are contributing to that. If I have a good paying job, if I have access to good meals, if I have sidewalks, if my community is safe enough for me to walk and I don't worry about how I am policed because I'm wearing a hoodie and all of those things, I'm more likely to be out there. And so we tell people to go to the gym. And so they drive to the gym to take elevator to the gym. But what about we build the community so that walking, it becomes the default, the easier option? That's what we're trying to get to.
Got it. Do we have any questions that we need to try to field or answer from the team? Okay. Dr. Areola has offered, if there are questions that come up for folks as they're reviewing the recording or listening to snippets, to still send them over to us. And even in between now and our next session, Dr. Areola and his team can provide some responses, some feedback. We are having, the village is hosting our community town hall with Kia on March 4th. So please mark your calendar. I think we're at the 37208 building. There will be a save the date that will come out with the exact location, but we're hosting a brunch. So we'll be there from 9 to 11 with Kia facilitating and anchoring us in this community safety task force conversation, getting feedback. So please stay tuned to your emails and the links to be sure to register for that. Dr. Areola, thank you. Thank you for joining us today, for me and my team here in the house, and for being willing to sit down and have some honest conversation.
Thank you, Erica. Thanks for having me. Thank you all for listening to me. Thank you to your team. Look, I'm just going to finish by saying, look, I need you to do my job. You are the public in public health. So I really, and you might have had this in different ways, but for those that I've met with, I say that with utmost sincerity. I look forward to building strong, trusting relationship with you. That way, we make Nashville a healthier community. We create conditions in every part of the county for everyone to be as healthy as they can. I really look forward to working with you. Thank you.
Thank you. I appreciate you taking me up on this offer and for us to create this space. We are right at time, and so we're going to go ahead and wrap up. I'm going to pass it over to Shekinah. I'm sure if you have any events that you want to drop in the chat boxes, she'll be sure to grab those for you. But Shekinah, turning it back over to you. Thank y'all for joining us today.
Thank you, Erica and Dr. Areola, for joining us today and facilitating such an insightful conversation. We will keep you all updated on when the next session will be. I dropped my email in the chat. And so, in between us waiting for updates on scheduling out the next session, if you have questions that you'd like to send in, feel free to email village@cfmt.org. And again, I dropped that in the chat. I also saw a comment about an inquiry about us maybe offering up, some space from Flurry. And so if you have just anything that you would like to contact the village about regards to space, upcoming events, and all the things, please feel free to contact that email, village@cfmt.org. Thank you all for being able to join us. I will stay on a few extra minutes if there's any announcements or anything that you all would like to drop in the chat and share with our community. But I know that we're at time, and so I want to honor, the time that you all joined us today. And so if you need to hop off, thank you again for joining us. Please feel free to reach out if you have any questions, comments, events, or just anything that you'd like us to know about. And I'll stay on a few extra minutes. Like I said, if anybody wants to announce anything to the community.
Hey, Shekinah, can we announce it now?
Absolutely.
Hey, this is Flora. Happy New Year. I haven't heard from you all and seen you all in quite a minute, but I do. I'm over here now in the heart of North Nashville off of Hyman Street, and we have a early childhood daycare center that we opened last year under Royal Table, and we also have an event space up front. So anytime anybody wants to have an event, you all know my email and my phone number. If not, I just dropped that flyer out there, and if you all want to have your upcoming event here with Kaya, you're more than welcome.
Thank you so much. It was great having you on the call today. I'll make sure I grab that flyer from the chat as well.
Hey, thank you.
Anybody else need to come off mute in the next few minutes before we hop off?
Hello, this is Brenda. Can you all hear me?
Hi, yes, we can hear you.
Oh, okay. I didn't.
Okay, wait, we heard you and then something happened. We can't hear you.
You can't hear me now?
Okay,
Yeah.
I can, we can hear you now.
You hear me now? I
Yeah.
just wanted to let everybody know that we will be doing, along with Belmont University and the Friends of the William Emerson Homesite Park and Gardens, a community Edge Hill preparedness seminar and resources cafe on February 27th. It will be at the Midtown Hills Precinct at 1441 12th Avenue South. Starts at 10:30, and it's just an invitation. I will send you a flyer because I'm half of 100 plus. I don't know how many, and I don't can't send it in the chat. But it was seeing everybody. And, people that I haven't seen or heard from, and I don't know when. So, love you guys. Have a great rest of the day.
Miss Brenda, it's so good seeing your face. This is Erica. It's good seeing you.
Hi, Miss Erica.
It's so good seeing your face. I heard your voice from the other room and came in here.
Oh my goodness. Yes. I hope you all can join us on the 27th at the precinct. I'll send the flyer over to the office.
Yes,
Um,
please.
yeah, I'll send it over there so that you all can see it. And anybody that wants to come and be a part of it, it'll be great. And Dr. Samney, I remember him from 11 years ago, Miss Erica. And we used to do lunch and learns here in the Edge Hill community at Kane Avenue and at the Resident Association community room. And he would come and do beautiful presentations to with the residents. And when you talk about this task force, I see that as being a way of, getting information from residents. Just make sure you got a survey with specific questions that you need answered. And we do lunch and learns every the last Friday of every month, starting in March. We will start doing lunch and learn. So I'm hopeful that he will be able to come out here and have lunch with us.
I wonder if there's an opportunity when we are with Kia next, well, the first week in March, for us to ask about surveys that can be distributed from hubs like yours. If she's unable to actually host something from the community task force, if there's an actual survey that we could send out, that you then as community builders can disseminate and gather information. So I'm glad you mentioned that. So we'll make sure we can create another spoke or
Yeah,
tentacle.
because if you remember, that's what we did with Imagine Nashville.
Mhm.
I had them to come over and talk with the residents at different events like the Night Out Against Crime, bringing surveys. And also, they sent me surveys that I would take to the Edge Hill Branch Library and at our resident meetings, at our Edge Hill Belmont Better Together meetings. And people, we just talk about, what we're trying to find out and get people's feelings. And they did surveys, and that was a big impact on Imagine Nashville.
Yeah, yes. Thank you for mentioning that. I'll make sure that we make a note and have Kia bring information or prepare it so that we can disseminate it afterwards.
Yeah, it'd be great to see Miss Kia.
Yeah. Good to see you. Hey,
All
hey,
right,
Brenda.
you guys have a great day.
Bye, Miss Brenda. I'm sorry. I'm looking at the caption. I'm seeing my name. So a call came in, but I said, let me get off this call. I got to get back on with my people. I'm looking at the notes. I can't see all of them, but I will make sure we're working on the survey link. I'll make sure that as soon as we get that you all have that survey link. And then I also will work to bring some materials so that each of you can take a packet with you of QR code and all of that. I should have by the time of our meeting, the citywide meetings scheduled. So I'll make sure that we have those dates available for you also so that people can come out in the event that they can't come to um, any of your focus groups that you might decide to have with me.
That is so cool. This is exciting.
So Miss Brenda, I need a focus group with ONE. I'm gonna email you, but I need
All
one
right.
with you all and the Edge Hill residents, but I'm gonna send you an email.
Sounds great.
I know a few people have had to jump, but I want to get Satori. I know you tried to come off mute a few times. So before we hop off, I do want to make sure you have a chance to speak if you're still on.
What's up, Chicago? What's up, y'all?
Hey.
Hey, y'all know I'm the hood. What's up? Hey, look, shout out to Kia. She knows that's my girl, Erica. Y'all know my girl. Look, I'm so happy to say I got a few people with me. I'm logged on on two different locations. Hold on, I'm gonna show y'all my folks that's here. Telling them about the village, honey. I'm telling them when I tell y'all. And look, let me see. Can y'all see them?
Yeah, we can see you.
I still got
Yes.
that. So they do some amazing things. They also provide y'all laugh. Look, they provide housing, guys. Like when I'm telling you, I'm gonna plug them in, baby. They ain't seen none yet. But listen, I'm so proud of y'all, and I'm just so happy to be here. And thank you for just having this meeting with Dr. Areola. And I really do appreciate that to give us more understanding of the work that we're doing, right? And I'm gonna pull up if y'all there. I love y'all.
Love you too.
We here. Um, I do want to honor the time. And so my email is in the chat. Please, y'all reach out to me. A newsletter will be going out on Friday that will have all of the information about Village Month, which is an upcoming series of events that will be happening in March. But we'll be kicking off with that Community Safety Task Force brunch, which is March 4th. And so the RSVP link will be linked in the newsletter that will go out. And so please reach out to village@CFMT for any questions, comments about that, and just keep an eye out for your emails, and we'll be sending that out shortly. Centoria, we at the Village House. If you want to pull up, we here. And I can't wait to see all of y'all at the task force brunch. So thank y'all so much for joining us. The basketball game. The first time we will see y'all is at the basketball game on Sunday and then at the brunch on Wednesday. So we look forward to being in community with y'all, in person with y'all. And until then, thank y'all so much for being able to join us. And we look forward to seeing y'all soon. Peace, y'all.